Hello and welcome to the AHPs and Quality Improvement podcast. I'm Jo Kitchen, host of the podcast and network facilitator. If you haven't heard of us before, you can check out our workspaces on the Q community or follow us on LinkedIn, and then you'll stay up to date with events and ways to get involved. Currently, we have got an exciting opportunity to get involved as a core connector and take part in our 6 weeks training programme to build your skills in networking, leadership and sharing QI. So if you're interested in that and it's still in April 2025, please get in touch. Today, I am joined by Alyssa Davies from the South West Royal Voluntary Service. This is really exciting because Alyssa is right in the middle of a fantastic project. And usually we only get to hear about this sort of thing at the end, not in the beginning. So today we're having a bit of real life learning and also spreading the word about a really great initiative that's happening. So welcome to the podcast, Alyssa.
Thank you very much.
Lovely to have you here today. Are you able to tell our listeners a bit about yourself and your background in healthcare and how you came to be in this role?
Sure. So yes, my name's Alyssa Davies. I'm the Regional Relationship Manager for the South West for a charity called the Royal Voluntary Service. I specifically work on a project in conjunction with NHS England that provides volunteers to support NHS organisations and patients. But in a previous life, I was the AHP Faculty Support Worker Project Lead for Cornwall. And prior to that, I spent over sort of 10 years working as an assistant practitioner in community therapy team here in Cornwall, and ultimately ended up with specialising in orthopaedic rehabilitation. So patients sort of post-care op, really. So that's my sort of AHP background hat. But really, when I was in that AHP faculty role, I really got some good opportunities to sort of progress and develop, firstly with the NHS Future Leaders course. And also,
that's a great one.
It's brilliant. I really enjoyed that. And also an ILM in Leadership and Management. So both of those had elements of QI that just sort of re-sparked my interest, I guess. I'd previously done a postgraduate diploma in exercise and health science. So I've had sort of exposure to research, and I was specifically looking at how exercise benefits patients with coronary heart disease. So, but that seems like an awful long time ago. So actually,
that's very interesting, though.
It was really interesting. Yeah, I loved it. But since then, sort of been working for a long time as an assistant practitioner, and then got developed into the AHP faculty role, which just opened up a few more doors for me, really, and enabled me to jump on a couple of really, really interesting courses that just reawakened that sort of research QI interest for me, which I'm really grateful for, because actually that both of those courses have been able to bring forward really into the role that I'm doing currently.
That's fantastic to hear. I remember a little while ago, there was quite a lot of discussion about some of the terminology we used for AHP support workers,
Yes.
because people had got into the habit of calling them like unqualified as opposed to qualified,
Yes.
if you were comparing qualified physiotherapist to a support worker. But actually, I think your case really illustrates it's not a question of unqualified, it's different qualifications.
Yes.
And actually being able to give you the opportunities to develop and learn and bring some of your earlier experience
It's whether you have
it's valuable.
a registration or not.
Yes.
Really is the bottom line. I mean, I at this point in life, I realized that actually when I was doing a postgraduate course in exercise and health science, what I probably should have done was actually a physiotherapy course. As interesting and as much as I loved the course that I did, career-wise, it's been quite restrictive.
Yeah.
And that actually is why I enjoyed the AHP faculty role, to be able to help develop support workers and to raise the profile of support workers, and to try and stop that divide, if you like, between the registered and the unregistered staff. The support workers we have, certainly here in Cornwall, are wonderful. They've all got huge caseloads. They're all working independently. They're all really experienced, and they are largely qualified in a different way.
Absolutely. And that has definitely been my experience as well, both as a more junior physio and then managing a team. The work of support workers has been absolutely invaluable in developing services as well, not just carrying out, say, a job list or something like that. Yeah. So tell us a bit about your role with the voluntary service.
So I'm a regional relationship manager, and I have conversations with all of the NHS trusts in the southwest. So my patch spreads from Swindon to Land's End. It's quite large.
It's huge.
Yes, and I'm just trying to facilitate conversations with those NHS trusts to see how our NHS volunteers can help facilitate some services, and that can range from volunteers helping to improve discharge, helping to improve patient experience, or supporting people that are lonely and isolated. Largely, a big part of our project has been about patient discharge and getting them home earlier in the day, that whole sort of home before lunch campaign. My role currently, almost accidentally, is all about change and improvement. It really all is about QI in a sort of almost disguised way. But yeah, so patient experience, improving discharge, and supporting lonely and isolated patients with our volunteers. And I think, in today's NHS and political climate, it's going to become more and more necessary for NHS organisations to fully integrate with VCSE sector, that voluntary community and social enterprise sector, because I don't think that they can do it all themselves. And that's from having spent a long time working for the NHS, looking out, and now from a VCSE organisation looking in. There needs to be much more sort of collaborative, joined up working.
That's really true. I think often the VCSE sector have that real understanding of local communities.
Yes.
And so when we have a push towards like place-based care and partnerships.
That neighbourhood, place-based, all of that. That they are the experts. Yeah.
So that's how you've been using your experience using quality improvement and change methodologies and the discharge things. Do you want to tell us about your new project at the moment?
Yes. So actually, when I first started with the RVS, I was shown a sort of PowerPoint presentation, and something really stood out for me on one of the slides, and there was a line that really kind of spoke to my AHP background that said, if 2 out of every 5 mobility aids were returned to a trust, it would save that trust £46,000 a year. And I just thought,
ooh, that's a lot.
That's a lot of money. That's jobs. That's employing more people. And that's from the NHS England website on the AHP Professionals Hub. So and I was just really interested in that. I've always had an interest on what can I do that's going to influence that? How can I challenge that a little bit? I'm interested in sustainability, so I was almost turning that quote on its head, because it's bigger than the money, actually. The money is one aspect, that money saving element for the trust, the ability to potentially, redeploy that money to do good elsewhere or employ more staff, is one aspect, but it's bigger than that monetary value. It's that wider sustainability impact, that act of reusing and recycling. What impact is that having actually? And then so this one line was in this PowerPoint presentation, and I went, I'm going to go and look that up and sort of dig a bit deeper. And actually there were more interesting lines to me in the rest of that document on the NHSE website, and what was more interesting to me was actually that reusing a refurbished walking aid is on average 98% lower in carbon emissions than issuing a new one.
That's a big
huge.
difference.
That's
Yeah.
huge.
And they have a life that's longer if someone's only needed one for a couple of weeks.
Yes.
They have plenty of life left in them, don't
and they're
they?
not single-use items, which people seem to think that they are. That that they're not single-use. And then there was a second line which resonated with me, being from the West Country as well. That actually increasing the return rate over 3 years could reduce NHS carbon emissions by 7,400 tonnes, which is the equivalent to 281,397 car trips from Bristol to London. But that's bonkers.
Those are some big numbers. And as well, no one wants these bits of equipment cluttering up their homes when they don't need them.
And that's just from returning mobility aids. I mean, it could go so much wider than that, couldn't it? But if we're focusing down on mobility aids, I just think that it's the reuse recycle impact. If we can get those mobility aids back to trust, help influence that NHS net zero target, it's a little change. It's only a little change that needs to happen, really, but actually it has a much bigger impact on that NHS net zero target.
Absolutely. And with our QI hats on, we know it's a good idea to start small, learn
absolutely.
as you go, fail fast if needed, and then go bigger afterwards. So you've got to really define, because there's lots of equipment. There is more than just mobility aids, isn't there? But you've decided to focus on mobility aids to start with.
It's often the smaller stuff that doesn't get returned. That we've got the big contracts with our equipment loans providers. Well, of course they want to bring the beds back. They're a high value item, but those lower value items perhaps are forgotten about a little bit sometimes.
Yeah, and when we talked about this, when we discussed this before, sometimes the cost of getting a van to go and pick up the equipment from stores, especially we're down in Cornwall where there's big distances involved, can be a bit tricky, can't it? So this is actually a bit of a gap, a real opportunity for volunteers to step into.
Yes, I think so. I've sort of turned my sort of volunteer hat on its head, really. And we've been helping with discharge. We're doing really well with that. How else can these volunteers be deployed? They're there. They're willing. They want to help the NHS. They're amazing.
Oh, that's really good to hear. So how did you set up this project then? So you had the idea, you had the statistics, knew you wanted to do something about it.
Yes. So I also knew that Greener AHP Week was looming, not too far down the road, around the corner. So I also knew, because of that, it could be, we didn't have a great deal of time, so it had to be a small start, really, that could grow later. We could learn from that small start and then grow. So I went back to my NHS Future Leaders sort of documents and my leadership and management course, and I thought, okay, I need to start small. Start with a driver diagram. What's my aim? What are my primary drivers? What are my change ideas? And I thought we'd just keep it really simple. So my aim was to increase the amount of walking aids that are returned to a specific NHS site to either be reused or recycled.
And for our listeners, just in case they don't know what a driver diagram is, you have the overall aim, and then what do you divide it into?
So I had the overall aim, and then I then had a primary driver. So my primary driver then was to contribute to NHS Net Zero. And then my secondary driver was the sort of time pressure of Greener AHP Week motivating me to be able to have some kind of impact during Greener AHP Week. Just start small. And then my change idea was, rather than rather than actually, so I then divided down again. So initially I was thinking that I would be going out to patients' homes, or our volunteers would be going out to patients' homes to bring equipment back to the local NHS trust. Actually, we don't have time for that this time round. But what I did have time for was to just do a quick survey of our local care homes that were around a specific sort of a radius from a specific community hospital. And I just sent them a sort of quick survey to ask them if they ever have mobility aid pickups from our local providers, or if they have a stock of mobility aids that are just cluttering up the place that they would like to return to be reused or recycled. And then I got some responses back, and I picked a couple of care homes that were in the vicinity of Launceston Hospital in Cornwall, and arranged a pickup with them. I was also working with my old job share, a chap called Guy Jedwab, who is now the AHP faculty support worker project lead for Cornwall, because I think first of all, I needed that link with CFT.
Yeah.
And secondly, I think actually going forwards, working with the support workers on this project would be really good. We've got loads of brilliant support workers in Cornwall, and they issue so many mobility aids. So to have an oversight of where these mobility aids are going to, and whether they are a for life issue or whether they are a short-term issue and actually could be drawn back, I think going forward would be really useful.
Yeah. Thinking back to my experience in care homes as well, when you're the ones in care homes, sometimes you're the ones who open a cupboard door and see a good selection of mobility aids.
Yeah.
So they are likely to know sort of which care homes might appreciate being worked with as part of this project.
Yes, for sure. Definitely. So I'd sort of done my driver diagram, and then I started thinking about my first sort of round of a PDSA cycle. So the plan, do, study, act. So my plan was to increase the number of mobility aids returned to an NHS site. And my do was to try and do that during Greener AHP week, that slightly pressured timescale. So I'd surveyed the care homes around Launceston Hospital, and I'd worked with CFT to be able to do this. And so we just picked 2 care homes in the end, but between those 2 care homes, we returned, and 2 volunteers, and then myself and Guy also went along to lend a hand. And between us, we managed to retrieve 25 Zimmer frames, and a bucket, or like I say, a bucket full of sticks and crutches. And
That's quite a
return them
lot
back.
from just
It's
two
quite a lot.
two care
Yeah.
homes.
Yeah, from just 2 care homes. Yeah, and when you go back to that sort of statistic, 2 out of every 5 recovered saves £46,000. Actually, we could be saving quite a lot of money if we go around sort of clearing out the excess from care homes to begin with. But now I'm thinking, how can we develop this? It went really well. It was a really nice experience for the volunteers. For me, I don't often get out and about able to meet my volunteers, so it's very local to where I am. I thought, I'm going to go out, I'm going to lend a hand, I'm going to meet my volunteers. So that was, it was all great, and the care homes were really grateful, because actually one of the ones had a garden shed that was just stacked full of these mobility aids, and they said they have, it's not just from their clients, it's from people in the local area as well that don't know what to do with them, that bring them to them and say, can you use this? So they've been collecting them, I think, for quite a long time, and they were very grateful to have more shed space back.
Oh, that's very good of them. And I think it shows as well, socially, people don't want to just take them to the tip. they can see that there is
Yeah.
future life in these
That
equipments,
somebody
and
else
that
must be able to use them. But what's also,
absolutely,
you do see sort of mobility aids in charity shops. You do hear of people that are passing on their equipment to a friend or a family member, and they haven't, it's not been necessarily been cleaned properly. The ferrules haven't been checked. It hasn't been resized. Really, it does need to come back into the NHS circulation to make sure that it can be refurbished and not just handed on.
yeah, absolutely. There's some advice alongside the giving out of equipment. Yeah.
I've been thinking there can be an annual amnesty from the care homes, because I don't think it, annual or maybe 6 monthly, but maybe a check-in every 6 months. Would you like to give the mobility aids back? We'll mobilise some volunteers and get them to come and collect from you. So yeah, either a 6 monthly or an annual amnesty of mobility aids from the care homes is how I think that particular sort of PDSA cycle could be developed. But then I'm also thinking, can this be developed a bit more so that we can actually pick up from patients' homes as well? For patients that can't drop off themselves. I mean, I think that there needs to be some education there as well when we're giving out mobility aids, that actually they're not single use, and if you reach a point where your mobility has improved enough that you don't need them anymore, then please either return them to a hospital site, or perhaps we can have the volunteers coming out to pick up at that point, to do a round of pickups. And maybe it might be useful for specific care services like palliative care or orthopedics, MSK, MIU, to have a link with our volunteers to say, oh, actually we've had a phone call and would you mind going to pick up?
Yeah, because typically people who might need mobility aids can't always just hop in the car and drop them back at a local hospital. So there needs to be personalised, doesn't it? There isn't just one solution that fits all, but having that flexibility of different ways people can return.
Yeah, definitely. I think that there does need to be some flexibility, and I know that most of our bigger pieces of equipment have stickers on them that says a phone number. Please, if you've finished with this, please return it to the equipment store, and ring this number to pick up. But it all comes down to whether there is the capacity for the loan equipment company to be able to do individual pickups to patients' homes. They drop off and they pick up obviously at the big sites, the big hospital sites, and they'll go and pick up a big bed from a home. But individual sort of mobility aids, Zimmer frames, walking sticks, I think it's less cost effective also for the trust, because they get charged per pickup. So actually, if we can mobilise our volunteers to do a larger pickup of those smaller items that are either then returned directly to the loan store or returned to an NHS site where they can be picked up more easily, I think there's something in that. It's thinking about that sort of going forward, that sort of co-production, sort of working with CFT, working with Mediquip, our loan provider, and also anything that actually is beyond repair, perhaps working with Cornwall Council, with our sort of being able to recycle it more easily. I know that there's a charity called the Waste and Resource Action Programme, and they have the Recycle Now website, and you can pop in your postcode and pop in that you want to recycle a walking frame, and it will show you whether you've got any recycling points in your vicinity. and I've popped in a few different Cornish postcodes in there, and I don't think we do. So I would really like to work with them and with Cornwall Council to see actually if people are able to take broken mobility aids to the tip, can that be a collection point for them to then be recycled properly? I think there's
That's
all
a really good
sorts of,
point, because some things are recycled and you can separate your rubbish at the tip,
yes,
but walking aids might be a bit more tricky. And I know there's
yeah,
this is very Cornish, and I feel like we are both down in Cornwall talking about this today. But I've noticed about wetsuit recycling has become
yes,
more of a thing recently. So now at the tip, there's a big container for wetsuits. So
yeah,
maybe it's sort of in a similar lines to that. There could be
absolutely.
mobility aid or equipment there.
It takes somebody that's willing and interested, doesn't it, to just make the links between all of those different sort of stakeholders. Really, it's
Yeah.
for all of our benefits if this happens. It, I don't know, this sort of sustainability hat seems to be an added extra onto people's workloads in a way. It doesn't seem to sit specifically with anybody. It's if you're interested and you're willing and you can take on a bit more, which is fine because I am interested and I am willing, and I know other people that are too. But it's making those links with all the different organisations to how can we make this better. To make thinking about what makes change happen and what makes it continue is people need to care. And they,
Absolutely, yeah.
in this scenario, people either need to care about the environment, they either need to or care about budgets or care about patient experience. And those changes need to be easy for people as well. If it's hard work, it won't happen, it won't stick. It needs to be a sort of time efficiency saving method. Well, actually using our volunteers should be all of those things, budget saving, time efficiency saving. They're super nice people, so they're nice to the patients when they see them face to face. So that
Oh,
patient
lovely.
experience bit as well. And people need to be able to see the change that they're having, that impact that they're having as well. They either need to see that money is being saved or that there are lower carbon emissions or that patient satisfaction survey has increased, I think.
Yeah, that's very true. And maybe as time goes by moving forward, whenever we set out to do projects or people apply for bits of work, then those questions about is the project, does it have an impact towards net zero for the NHS?
Yes.
Or what is the environmental impact? Is there a negative impact or a positive impact, to just make you think a bit more, even
Yeah.
when your role isn't sustainability lead or something
Yes.
like that? We can
Yeah.
all look for little
I think
changes.
it that's exactly it. I think if everybody makes a little change, it adds up to being a much bigger impact. But it's putting that sort of sustainability, putting that greener hat on in all aspects of work. Really, we're all encouraged to not print out emails anymore, and to and a lot of us are working from home, so there's that sort of, you're not driving back and forth, no lower carbon emissions, that sort of thing. It's just, what little things can everybody do in their working lives that actually adds up to a bigger impact.
Yeah, very true. And that is a brilliant message, I think, to finish with on Greener AHP Week. So one lovely thing about this podcast is we will share it with our AHP QI community. Is there any other support from our AHP community that would be valuable for this project, Alyssa, or anything you would like from our listeners at this point?
Well, I think that it's that joined up thinking again as well, isn't it? I'm sure nationally, regionally, that there are other people that are doing mobility aid projects out there. It'd be really nice to link in with them to see what successes they've had or what learning experiences they have had, and to be able to almost get a blueprint between us what works well and get a bit of a blueprint to be able to roll out and offer to other people, so that actually they're not having to start from scratch if they're looking at this for their trust. Actually, we've done this. This is what worked. This is what didn't really work. And here's the sort of best case scenario, and take it and run with it.
Absolutely. It gives people a head start in terms of
Yeah.
ideas and experience. And then also, if you're having to persuade people to try something new, we talked about those stakeholders, having some facts and figures that people in other places have been able to do this.
Yes.
And this is how they use their volunteers. That's fantastic. Thank you ever so much for joining me today, Alyssa. That was a really interesting conversation. And I hope the rest of... Absolutely. I hope the rest of your project continues to go well and be really successful.
Thank you so much.